Today we're talking to Sumeet Aggarwal, who went from management consulting to a research fellowship at the World Economic Forum and then a role as director of the chairman's office at Fortis Healthcare. People have heard of the World Economic Forum, but maybe not Fortis Healthcare. What does the company do?
Fortis primarily started in the tertiary care, which is the hospital space in India, and now we have the largest primary care network in Hong Kong. In the dentistry space, we are the largest dentistry network in Australia and New Zealand, and we are into secondary care as well in India and in markets like Vietnam and Sri Lanka. So,
I'm not sure everyone will understand that jargon, Sumeet. Can you say what those distinctions mean? Primary, secondary, tertiary?
So primary care is also mentioned as something like inpatient or outpatient care, which is where you go and see a doctor in a clinic, but you do not require any hospitalization. Secondary care is where the patient is in the hospital but doesn't require a very specialized treatment, while tertiary care is where you look at specialized care for the patient.
What's the current state of the healthcare industry globally?
I think the healthcare industry currently is one of the fastest growing industries. Macroeconomically, there are several factors which are influencing this industry. The first one being that the governments themselves aren't able to, the public systems in many countries cannot take care of the healthcare needs of their people. So that makes it even more interesting in the private sector for companies to come in and play, whether it be in the different, as I said, primary to tertiary sectors. There's a lot of space for private companies to come in. The GDP spend on healthcare, if you look at it across the world, it's anywhere from 17% in the United States to a very low 2 to 3% in some of the Asian countries. So there's a lot of scope in terms of improving healthcare, improving access, improving the patient experience, and a lot of room for innovation in this.
You work in developed countries, but also some less developed ones. Are the challenges the same?
The nature of opportunity, I think, in the less developed countries remains in terms of access. So access to healthcare itself is not there yet. And I think that allows for a lot of innovation. So their governments in these less developed countries aren't able to take care of their citizens because they don't have the appropriate funding. And that is something they work with international organizations, various banks to attain that. But in the private sector space, how can you provide high quality healthcare at a price point which is affordable to the masses? And that's what we are concentrating on.
So what's the answer to that problem of providing affordable healthcare to masses of people?
There is, again, healthcare is a very local business. So there is no model that you can replicate from one country to another. But I think what is essential is to look at what are the innovative mechanisms. So mobile health, for example, is one of them. The ability to replicate some of the best practices that are available in, say, a country like India, where a lot of there are great examples in eye care in terms of hospitals doing delivery for women at a price point which is available to the masses. So you cannot completely replicate them, but there are certain things which can be brought into a country like Vietnam or a country like Cambodia, Burma, where you can have the same ingredients put in. So, but again, it's a very localized play, and resources is always a challenge in healthcare.
How open is the healthcare industry to people who want to come in from other sectors?
I think from coming from an unrelated industry into healthcare would be would require some experience or some ability to connect through the various entities or or the different sectors within healthcare. I think there is the payer, the provider, the medical devices, the pharma. So to understand how there's an interplay amongst these different subsectors within healthcare will be important, one. And second, it would be important to see how the other industries have an impact on healthcare. 10 years from now, there will be 9 billion people on Earth, and the demand for healthcare, the services that we need to provide will be constantly evolving, and having that passion to do something and make a difference would be key to succeed.
You've successfully made a big career transition. How would you advise people who want to do the same thing?
I think my advice would be that network. That would be the first thing that I would advise, because I think opportunities are available, and many times it's all about asking people, and many people just don't go and ask for the opportunity which does exist. So that's one. When I say about asking people, it would be more of building relationships which are meaningful. So whether you meet people at conferences, whether you get to know them in your daily work life, you start thinking as you are going to different jobs and you're making transitions within your own company, they will be also moving places. So I think building those meaningful relationships on a continual level helps, because then you are able to go up to them and ask for the opportunity down the road. And many times it's all about who you know, which works.